healthcare, let's not forget about Alkermes, A-L-K-S, a different kind of drug company that specializes in drug delivery technology, allowing them to create long-acting formulas of existing medications. In other words, Alkermes makes it easier for people suffering from diabetes, schizophrenia, or bipolar disorder to take the medicine regularly with extended-release injections that need to be taken far less frequently. That way they stay on the meds. In the past, Alkermes was all about drug delivery, with the core of its business made up of extended-release products like Risperdal Consta or Invega Sustenna and Bydureon for diabetes. Lately, though, the company has been more focused on developing its own new drugs in-house. Right now, Alkermes only has one of these on the market, Vivitrol, a once-monthly injection that helps alcoholics and opiate addicts stay on the wagon. Now, meanwhile, Alkermes has some exciting stuff in the pipeline, including a long-acting anti-schizophrenia drug and a drug for treating major depressive disorder that's in phase 3 and has already been fast-tracked by the FDA, potentially great benefit to 6.2 million people who aren't responding to other therapies. Now, Alkermes has already given you about 125% gain since we last spoke to the CEO nearly a year ago, February 2013. But with so much on the horizon, I wouldn't be surprised to see if this stock didn't have more room to run, especially if the company just raised $250 million from Invesco yesterday, which shows they have the money to make the transition from a drug delivery play to a major pharma company. Let's dig deeper here. Richard Pops, Chairman and CEO of Alkermes, get a better sense of what's happening with this company and what's next. Richard, welcome back to the show.
Good to be here, Jim. Thank
All right, you did something I think is really important. A lot of the companies we deal with that are earlier stage have to give away a lot of upside in order to be able to get the drugs in the market. You've been able to connect with a major mutual fund, basically, to be able to keep the upside. Is this the new way to do things?
Well, as you know, this business is about capital. You need capital, you need fortitude, and you also need strong shareholder base. We actually had plenty of money going into this, but when we were approached by Invesco in the UK, a preeminent investor, to take a big stake in the company today at these values, we said that makes sense for the long term.
And it also keeps you from being, keeps the company from being stolen by a major drug company if you ever got into a real cash bind, right?
Well, we think we're in the position now where we've got 5 or 6 blockbuster potential medicines in development. And it's exactly the wrong time to think about losing the company. We want to push these drugs through development, see what they're worth for the benefit of our shareholders.
All right, I want to talk about ALKS 5461. This is a clinical development plan, 3 pivotal trials, collectively enrolling 1,500 patients. Major depressive disorder. Is this something that works that nothing else, for people who nothing else is working for?
That's right. So about 11 million people a year, 11 million in the U.S. go on antidepressant medications. And many of them are generic and very good medications. But about 5 million or so people don't just fail one, they fail 2 and need to go on to a 3rd and might even have to go on to antipsychotics because their depression is so bad. 5461 is directed toward these specific patients who are failing to get adequate clinical response on the well-established medications. And data in phase 2 has been very powerful, and we're launching that pivotal program, as you said, as a fast-track medicine this quarter.
Now, this is going to be with major psychiatric hospitals or major hospitals that have psychiatrists' house. Where are people getting how do you get into the treatment?
Well, the study will not be, it won't be massive. There'll probably be 20 or 30 sites in the U.S. And if you go on clinicaltrials.gov, we'll list the trial sites. But the goal is to run the phase 3 program as expeditiously as possible, get the result we hope and intend, and then get this drug approved by the FDA and so people can benefit from it.
All right, how about the long-acting anti-schizophrenia? Where are we? And do you you're talking about something like 2015, not that far from now.
That's exactly right. We're going to get pivotal data from the phase 3 clinical trial in the first half of this year in 2014. So we've enrolled all the patients in the study. It's about a 600-patient study. It's gone quite well. So we'll get those data in the second quarter, let's say. We'll file the new drug application thereafter and hope to be on the market, if successful, in 2015. Now, this is a market that's on the threshold of big-time change because the data is becoming increasingly clear that for patients with schizophrenia, adherence to medication, if we can ensure that patients are on their medication for longer periods of time, leads to much better outcomes.
You're talking about only 6 injections a year?
That's right. You know, the first product that we're getting the data from in the next quarter or so is once a month. But we just announced last week that we're also working on once every 2-month form. So that's right. There would be 6 injections a year providing modern, state-of-the-art antipsychotic treatment.
Weight gain or no?
Well, this is Abilify, so this is one of the best tolerated of the antipsychotics.
Okay, Richard, in the time left, the anti-opioids, I thought that were really a terrific category. Vivitrol's growing, but not growing doing the way I expected? Is it because people are still sticking by other methods to try to fight alcoholism and drug addiction that may not be as empirically effective as this drug?
We're changing the way the world works now with our approach to opioid and alcohol dependence with Vivitrol. The great news about Vivitrol is that it's very effective and it's on patent well into the 20s. So as we chip away at changing the treatment behavior, as we get more and more data that shows that treatment with a once-a-month injectable product that blocks the opioid receptor can have very favorable outcomes, I think we're on the right track.
And one last question. You had a criminal justice trial. Anything coming from the prison systems in order to make it so there's less recidivism?
This is an area of great interest of ours. In fact, now in almost 30 states around the country, we have pilot programs in the criminal justice system that's very interested in using a long-acting antagonist that blocks the opioid in the form of once-a-month injection. So we're getting a lot of data from those studies, and we expect that to build over time.
Well, you're building a major pharmaceutical company, Richard, as you promised many years ago when you first came on the show, and you've been delivering over and over again. Thank you so much for coming on Mad Money.
Well, thank you for your support, Jim. We're hard at it.
Right. When we first saw this company in the teens, we realized the tremendous potential. You know who's realizing that potential for you is Richard Potts. Mr. Potts is chairman and CEO of Alkermes, aka Alks. I would still be a buyer of the stock. Stay with Cramer.